Hello and welcome to this week's What Were They Thinking? We begin with the news we'd been expecting to see about the CCP virus. Young children, particularly from daycare, are picking up the CCP virus, taking it home and giving it to their parents. This adds to the growing concern that we had that returning to school and other similar occasions and places for children could allow the infection to continue spreading, albeit at a reduced rate. We know that very young children are vulnerable to being infected, much like the elderly. This isn't a surprise. We know that their immune system is not as capable as an adult. This is now being confirmed from studies being published by the CDC. They find that 12 children have been infected by someone else at the daycare center, but the children had very little to no symptoms. This then allowed them to take the disease home and spread it. The rate at which these children can spread the disease was sitting somewhere around 1 in 4 people they came into close contact with. That's 25% and is uncomfortably high. While on the topic of patient recovery, we should talk about long-term results. It shouldn't surprise you to learn that the CCP virus, after impacting both the lungs and heart, would lead to long-term fatigue. Or at least, those are the findings in another study this week. What they've found is that, based on the roughly 30 million people who had been infected in the world at that time, and the nearly 1 million who had died, there was evidence that patients, after they had recovered from the virus, were experiencing severe fatigue, even though physically they should be fine. The study itself followed 128 patients, and this means we're talking about a small cohort. Of these 128, 52% continued to experience fatigue 10 weeks after they had ceased exhibiting any of the symptoms of infection. This is regardless of how bad the infection was. That means those who were mildly or severely sick would still be experiencing persistent fatigue. These longer-term consequences of infection by the CCP virus stand in stark contrast to the growing evidence we have and knowledge of how it acts immediately and in the short term after infection. This includes some recently published images showing just how the virus itself can infect lung cells. This sort of knowledge is important for us to understand what is happening and how we can interfere with its ability to infect certain cells, or possibly support those cells once they have been infected, allowing for faster recovery. In this case, they cultured human bronchial epithelial cells and the virus for 96 hours. Then they scanned it with electron scanning microscope, and you see the images that have been falsely colored here. Some of the important takeaways immediately are that the number of virions being created, that is those virus particles in red, is incredibly high, which means you're getting a lot of virus out of a relatively small number of cells. The type of cells they were culturing them with are what would normally divide the blood from the lungs, and it's what allows for gas exchange. Once these virus particles were freed up and allowed to move around the lungs a little bit, they'd eventually find their way working upwards towards the mouth, where they would eventually hit the cilia and be coughed out. And this is how we begin to get those virion particles, or in some cases, droplets. While we're on the topic of releasing the virus, we should touch on the severe criticisms of a recent paper and some recent media discussion around the idea that the virus could have been a laboratory product intentionally released, and fundamentally what boils down to a conspiracy theory. The paper itself is published by 4 Chinese researchers who, for lack of a better term, defected to the US earlier this year. This means that they do have at least some bias in what they're writing, but they could also be describing what they know of China's internal research that is yet to be fully understood in the rest of the world. We know that historically China has been none too cautious in how they dealt with certain viruses in the past. For example, the time they combined both the swine and bird flu viruses. This means they were creating something that was highly infectious, but incredibly lethal in how quickly it could kill someone. This means it had the best of both worlds, so to speak. This was done almost because they could, rather than for a beneficial reason. The fact that China has historically been less than cautious does not mean that they've necessarily done something nefarious this time. And that is one reason why this particular article is on a preprint server and has not yet been peer reviewed. This has not prevented some of their peers, and for that matter some of the experts in the field, from going through the contents and, for lack of a better word, identifying flaws. Some of it is more concerning than others. One of the bigger concerns at the moment is that none of the researchers are currently affiliated with the university, but instead with what should be considered a political non-for-profit. Beyond where they are currently employed, there are other concerns about which particular data they've selected to include in their study and what they've chosen to exclude. There are also somewhat more rigorous studies going back as far as March that have demonstrated that the claim that it could have been developed in a laboratory is, if not incredibly unlikely, impossible. Going from what should be considered gossip, we can examine something that should be considered more definitive. That is, the Oxford University and Astrazeneca vaccine trial has resumed. It was paused, as is standard protocol for a clinical trial after one of the participants became seriously ill. Until they could figure out exactly what was happening, they weren't able to move forward. Now they know what it was, and they're happy to go forwards with the trial. Doing so ensures that the vaccine they bring to market is safe, effective, and hopefully reliable. That will prevent people from having to worry about unexpected consequences. That vaccine is having so much more trouble than others because it's relying on newer technology. Conversely, China might actually be the first country to bring a vaccine to bear. This is because they are fundamentally using the same technology we've relied on for decades. The simple version of this is that they take the virus or other pathogen, treat it in such a way that it can no longer be effective as an infective agent, introduce it to the host with a variety of other chemicals and drugs to stimulate the immune system, and let the body very quickly figure out what's going on. This is what you see in most of the standard vaccines that are in use today. In fact, much of the technology being trialed for the CCP virus vaccine hasn't really been used before now. The Chinese vaccine is going with what is, effectively, a tried and true approach. This would be why their phase 3 trials of a large scale have demonstrated efficacy, or at least so far have demonstrated efficacy in preventing participants from contracting the CCP virus. This is a big hurdle and could be a way, if not the only way for now, to stop the spread and slow it down enough that we can get it under control in many countries that are experiencing resurgences or have failed to yet get the CCP virus under control. The availability of the vaccine is going to be one of the next big political issues. We currently face possible diplomatic and economic war between America and China, military conflict between India and China, the geopolitical situation in Europe, and all manner of other problems. But the next big flare-up could be the issue of who will get vaccines and when. This is being compounded by a statement by the head of the Serum Institute of India, pretty much one of the world's largest vaccine manufacturers. They have said in no uncertain terms that they do not see that there will be enough vaccine for the CCP virus available for everyone until the end of 2024, and that's at the earliest. They put this down to the fact that pharmaceutical companies are not increasing their production to a point where it would be able to create enough vaccines in any less time than that. This repeats statements that the World Health Organization's chief scientist has said, where they believed it would take 4 to 5 years before the pandemic was under control. We should consider this in the relative context of what happened with Spanish influenza in 1918. It burnt through the population, causing mass death relative to the size of the population at the time. By comparison to what we're seeing now, the CCP virus is slightly slower burning but causing more death over the long term, and if it's going to continue for years rather than a year, we need to be more concerned about implementing appropriate policies and measures. On the topic of diseases and massive death, we should talk about the mass die-off of birds in the United States of America. There's been what is effectively a mysterious disease causing massive death of birds in the United States of America, and it could be causing millions of them to die. Most of these are migratory birds in nature, and as a result we're seeing the phenomena both in New Mexico and further across the country. There are a variety of theories as to why and how this has happened. The two leading contenders, which may also be working together, are that a recent cold period has led the birds to begin their southerly migration early. The alternative is that the Californian wildfires could be putting enough smoke into the air, forcing the birds to take a new route away from how they would normally travel. In either case, it's prematurely either led to their early departure or extended their travel time. This might explain why most of the birds are very emaciated and have almost no muscle mass. That is, they've been flying until they couldn't get any further, then they've dropped to the ground where they would normally feed themselves, put on more weight again in preparation to continue their travels. But because they were forced to leave early, or have taken longer than planned, they may not have the option of being able to put on weight, or they may not be able to survive long enough to do so. While still talking about animals, except this time we're going to go back 100 million years and talk about animal sperm. Jurassic Park, if not entirely accurate, had at least one thing right. Amber is a great way to store certain things. In this case though, it was sperm. The organism we're talking about in this case is one of a larger family of, if not necessarily common, well-known creatures. It's a family of microcrustaceans known as ostracods. They are notorious for having giant sperm in size. Samples found frozen in amber are no different. In fact, it would appear that the particular ones they found in this case had only just finished reproducing. This was identifiable because the females had an expanded state due to being filled with sperm, according to one quote. Further, that quote says that this indicates successful copulation had taken place shortly before the animals became entrapped. Our final news indicates that no good deed will go unpunished, and in this case, one of the people responsible for protecting Brazil's indigenous groups has been fatally killed by one of the members of the tribe. The Amazonian rainforest is large and contains a number of peoples who have been isolated from the rest of the world far too long to be able to be incorporated readily. They live in a tribal lifestyle. They generally are relatively subsistence living styles and don't have access or understanding for what the rest of the world contains. In order to ensure they're both protected and to ensure that they remain, if not untainted, at least happy in their own lives, the plan has been to leave them alone. Not everybody agrees with this idea, and as a result, some countries, particularly Brazil, have set up groups to protect them from interference. One of these is Brazil's Indigenous Affairs Office. While the office itself refuses to say how he died, witnesses from around that time report that he was hit with an arrow. The current assessment of what's happened is that where previously large groups have passed by in a peaceful manner, this time it was a small group of people and armed. It's thought that it was in response to something that had happened to them. In the past, they've responded to events where illegal mining operations or poachers have interfered with their lifestyle. It is believed that this may be what has instigated the recent attack. It's unlikely to be able to find out exactly why they've acted the way they have. In the past, contacting isolated tribes like this has led to massive outbreaks of disease. Things like smallpox, even the common cold would be enough to kill them, and so trying to interact with these peoples is incredibly difficult, and so it's unlikely we'll know at the moment. Possibly there may be some explanation or response to what has occurred, but that'll be something to report on in the future. Those are all the items we had to report to you this week. Thank you for watching this video. If you found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions you might have below